Knock, knock, knock.
Hey, how are you?
Hey, my name is Isaiah. I am going to be your student nurse today. Can you please tell me your name and your date of birth?
Greg Timms, 10/31, 1962.
And can I take a look at your wristband to
Sure.
double check? Okay, it looks good. I am going to provide privacy and I am going to wash my hands. I am looking at your doctor's order today, and it says that we need to do a head to toe assessment, so we're just doing an entire checkup, okay?
Okay.
So, right now, I am noticing, looking at my patient, he is maintaining eye contact. His his level of consciousness and orientation is okay. I'm going to ask a couple questions to assess that. Uh, do you know where you are today?
Yes, I am. I'm at the doctor's office.
Can you tell me what day of the week it is?
It's Saturday.
And can you tell me who the president is?
Trump.
Donald Trump? Okay. And so we assess his level of consciousness and orientation. I'm taking a look at his physical self. He is well groomed, symmetrical, bathed, all of that. Assess his speech, hearing, vision concerns. We'll get to that. Do you mind if I touch you?
Please.
Okay.
I mean, it's fine.
Okay. I'm just touching your head to see if there are any, inspecting your head to see if there are any bumps or contusions or anything, which there are not. I am going to touch your skin. Can you hold your arm out? So just flip it over. So you got regular, your skin temperature seems fine. It is not cold to the touch or too hot. If it were a cold, that could indicate a blood clot. If it were hot, it could indicate fever. The skin color is normal for his ethnicity. There are no bruises or bumps or scars or anything like that to be noted of. That. Hey, one more time. Can you lower your shirt a little bit? So I am just inspecting skin turgor or elasticity by pinching his collarbone. And it goes right back down, so that means he isn't dehydrated. So, inspect. So some risk factors for skin breakdown, which I do have to let you know, sir, is either excessive moisture from exercising or from bathing too much. Skin breakdown can be caused by just sitting on the same place all day, every day. And of course, if you get yourself a scratch or injury and you don't take care of it, that could cause an infection. Okay?
Okay.
So I did inspect the head and face for general size, shape, and symmetry. You feeling okay in this area? You have a headache or your skin feel?
No, I feel fine.
You
no
feel
headache.
fine? Good. Ears. Can I see your ears?
Sure.
And I'm just looking at symmetry. And kind of look at your other one. And can you hear fine in both ears?
Yes, I can.
Awesome. So now we get to look at your pupil light response, accommodation, and pupil size. So just open your eyes and look at me. I'm seeing if your eyes dilate. Okay. Just dilate. And I want you to focus on this. And cool. Do you have any issues with your vision?
No, I do not.
You do not. Okay. All right. So lift up your head for me. Just look at your nose. See if they look equal. And I want you to press down one nostril and breathe in. And one nostril and breathe in. Have you ever had any issues with breathing in and out of your nose?
No, I have not.
Okay. Does it hurt? Does it feel normal?
Feels perfectly normal.
Okay. All right. So I want you to open your mouth for me and look up at me real quick. All right. So the mouth has a normal color and moisture. I'm going to hold on to your neck and I want you to swallow for me. Okay. You swallow perfectly fine. Everything looks good. Have you ever had any issues? Your speech is fine also. Can you do me a favor and do this? And do that. Okay, everything looks good on the neck. Does your neck and oral area, everything feel
Yes.
normal? Ever had any issues with it?
Never have. Everything's
Okay.
normal.
Alrighty. So we did neurological. So we did your respiratory rate earlier. You had 16 breaths per minute, which is the normal breath rate. Auscultate. So what I'm going to do is I'm going to listen to your lung sounds, okay?
Okay.
And all you gotta do is just breathe normally. Upper lobe, left lobe, right upper lobe, right middle lobe, left lower lobe. Can you turn on your side for me a bit?
This way.
Yeah, and lift up your arm. Right lower lobe. On your other side. Left lower lobe. Okay. Left upper lobe. Right upper lobe. Right middle lobe. Left middle lobe. Okay. There were no adventitious lung sounds to be heard. Have you ever had any issues of breathing, sir?
No, I have not.
All right. So what I want you to do real quick, I want you to just take a cough. Do you feel like any sputum or mucus or anything come up when you do that?
Nothing.
Okay. Now, something I want you to do, one more time, I'm going to have you cough again, but I want you to do, you got to turn, you got to cough, and then you got to take a deep breath. And you can breathe back out. Yeah. And so that's just to make sure you're.
Do I need to do that again?
If you could, just one more time. Yeah. And perfect.
Okay.
And so I'm going to grab an incentive spirometer real quick.
Okay.
So this right here is an incentive spirometer. All we are doing is we are measuring your inspiration. Inspiration being when you breathe in. So hold on to this and put it up to your mouth. And all I want you to do is just breathe in. Okay, and the measuring device within it, it got to the normal level, which is what we want to do. What I want you to do is I want you to use this incentive spirometer 10 times an hour during the day and just breathe in like that, and that's how we're going to measure your inspiration. Make sure it just stays on normal level.
Okay.
Otherwise, though, you did say that you never had any issues with your breathing.
I've never had any issues
Perfect.
with breathing.
All right. So I did check, when I checked the neck, I noted that there was no a jugular venous pulse or distension. So what I'm going to do now is hold out your arms, and I'm just going to measure the pulses on both. Make sure they're equal, which they are. Flip your arms over for me. So gonna do the capillary refill, and they refill in less than 2 seconds. Can you take off your shoes for me?
Yes.
And I'm going to be checking the pulses on the dorsalis, pedis, and the posterior pituitary. Alright. And normal pulse there. Normal pulse. Okay, so what I did his radial pulses on his wrist, his dorsalis pedis on his feet, and his posterior pistol on his feet. Alright. So one more time, let me see your hands. I'm checking for edema. All that is when I press down on your skin, if it makes a little impression, that means you have edema. And it means you have a heart problem. But you do not have that on that arm. Nor on this arm. Let me see your legs. Just gonna roll up just enough to check. which you can tell from here you don't have it. So no edema is noted. All right. Before I do the last part of the cardiac assessment, you have a history of heart attacks?
I do not.
Or have you ever had any heart problems during your life?
None.
Perfect. All right. So, I just want you to stay still for me, okay? So, I am checking the aortic pulse. Pulmonary. Herb's point. Tricuspid. And mitral. All right. There were no adventitious heart sounds noted during the inspection. All right, we are in the home run here. Sir, I want you just to lie down for me, okay?
Okay. This way?
Yeah, just like whatever's
Okay.
comfortable.
All right.
All right, just move your hands. So, do that. We are checking the bowel sounds. For the sake of the video, I'm going to say the patient lifted up his shirt. So, you start on the right lower quadrant. Right upper quadrant. Left upper quadrant. And left lower quadrant. Bowel sounds were normal active. Either they were not hyperactive or hypoactive, which doesn't mean anything bad. It means your bowel sounds are normal. I'm inspecting the skin. Do you feel any pain in your stomach area, sir?
I do not.
Okay. So skin felt normal or normal tensive. Sir, can you tell me when your last bowel movement was?
Yesterday.
Okay. And have you been gassy?
No.
Okay. Okay. So you can sit right back up for me. Alrighty. So we are going to do the range of motion. So I want you to extend your arm out and so I want you to hyperextend like this and flex. Now do it again and push up against it. Now. Okay, we're gonna do the same thing. So extend, flex, now push up, push down. All right, we're gonna do the same with your feet. So I want you just to extend it, flex. All right, one more time. Extend it and flex. All right, so you got a good range of motion. Now, can you stand up for me?
Yes.
So here, and let's to the side, like face me. Just gonna hold it like this. Gotta let go. You can maintain your balance. Now I want you to just walk this way. Walk back. And you do two more things. I want you to walk on your tiptoes. Now walk heel to toe. Okay, and you do so fine. Sir, have you fell?
I have not.
You have not? You can take a seat if you want to.
Okay.
Do you use any assistance while walking?
I do not.
You do not? You never had a history of falling?
No.
Okay. All right. So the last thing I have to ask you is, when was the last time you urinated?
This morning.
This morning? And everything was okay?
It was clear.
It was clear? Are you normally hydrated?
Normally, yes.
Okay. And how many times would you say you urinate during the day?
Nothing unusual.
Okay.
4 or 5 times, maybe.
Noted. Okay.
For bed.
So I'm just gonna double check my paper,
Okay.
make sure my order, and make sure we got everything Well, sir, everything looks A-okay.
Very good.
So we're going to have your doctor and your healthcare provider come in. You just hang tight. Thank you very much, Mr. Thomas.
Thank you.